Many health professionals would like to know how to assess, how to address patients' religion and spirituality. The most agreed application of religion and spirituality to clinical practice is taking the spiritual history. Taking the spiritual history is basically to explore the importance and practical implications of religion and spirituality in patients' lives, and how it applies to their illnesses, how they use this religiosity and spirituality to cope with their illnesses. And there are some evidence showing that addressing patients' religiosity and spirituality is associated with the higher levels of patients' satisfaction. Just to have you an idea, in a study with more than 3,000 internal medicine inpatients at a university hospital in the United States, 41% of patients desired a discussion about their religion and spirituality. However, only 20% of patients had these discussions. But what was interesting in this finding is that patients who had discussions on religion and spirituality with their clinicians were 40 to 120% more likely to rate the quality of their health care at the highest level. So this is one of the studies, but there are several other studies showing that addressing religion and spirituality of patients is associated with higher satisfaction of patients. How can we address this? Taking the spiritual history, there are several questionnaires that help us to address patients' health and spirituality. One of the most used is the FICA, F-I-C-A questionnaire. F is for faith and belief. We can ask the patient, do you consider yourself a spiritual or religious person? Do you have spiritual beliefs that help you to cope with the stress? So we address patients' health and belief. And if they are not religious or spiritual, we can ask them, what gives your life meaning? The F. The I, the importance and influence of this spirituality and religion. We could ask, what importance does your faith or belief have in your life? Have your beliefs influenced how you take care of yourself in these illnesses? Importance. The C is community. Are you part of a spiritual or religious community? Is this of support to you, and how? And the last aspect, A, address in care. How would you like me, your healthcare provider, to address these issues in your healthcare? So basically, the FICA, the FICA questionnaire, it takes usually 3 to 5 minutes only to be used in a clinical encounter, and it helps us to address the most important issue in patients, spiritual issues in patients' care, and it helps us to connect better with the patients and to show the patients that we are interested, not specifically in the disease, in the illness, but we are actually interested in the patient as a whole.